Good afternoon, everyone, and welcome to PTAC's Prosecutors Conversation with the Field. Today, we're going to examine the prosecutor's role in deflecting those with behavioral health issues away from the criminal justice system. My name is Dave LeBon. I'm the president and CEO of APA, also known as the Association of Prosecuting Attorneys in Washington, D.C. And we will have two presenters today, John and Melissa. John, do you mind saying hello and letting the audience know a little bit where you're from?
Yeah, thanks, Dave. Hello, everyone. I'm John Hummel. I'm the elected district attorney in Deschutes County, Oregon. Our county seat is Bend, Oregon. We're in the center of the state, a resort community in the Cascade Mountains. Been the elected district attorney here for 7 years. Happy to join you today.
Excellent. Thanks, John. Now we're going to jump to the other coast. Melissa, do you mind saying hello?
Good afternoon, everyone. My name is Melissa O'Marin. I'm an assistant prosecutor with the Burlington County Prosecutor's Office in New Jersey. I am currently located in Mount Holly, New Jersey, just a little bit outside of Philadelphia.
That's very helpful for those of us that don't know your state that well. And then before we get into the program a little bit, let's hear from Jack about the purposes of PTAC and what is PTAC.
The conversations with the field, what are they? This is something new, something very exciting that's never been done for our field of deflection and pre-arrest diversion. We're a very young field, but you've got a place where you can come and listen to folks as well as share with others what you are seeing and doing in a wide range of topics. Deflection and pre-arrest diversion, law enforcement, fire, and EMS are working together to connect people who are in need of substance use disorder and mental health treatment into recovery for themselves, for their families, and for their children. All
right, and as Jack was pointing out, this is supposed to be a conversation with the field. And while Melissa and John and I can probably fill the full hour and a half, we really recommend and welcome folks to use the chat box. If there's something on your mind, something you're hearing from the policy, the 30,000-foot view, or the practical, how do I really do that? I would like to get those questions in there, and let's get the panelists to answer them and try to help all. With this, I think let's learn a little bit about John. I've known him for a while, but I think this brings a very interesting reason and role as to why he went where he went when he became the elected DA. So if we can get a little background on John, please.
That was an honor of a lifetime to represent former President Jimmy Carter and to be welcomed into Liberia by President Ellen Johnson Sirleaf, who's now a Nobel laureate based on her work, saving her country. President Carter was invited into the country to help Liberians recover from their brutal 15-year civil war. We worked to train judges, prosecutors, defense attorneys, police officers how to run a functioning justice system, kind of based on a Western model. But we also worked with chiefs in Liberia to help them improve their community justice work, because we heard from Liberians they were fine having a Western system of justice. They had no problem with that, but they really liked their traditional justice systems. It was accessible. The chief was right in their village. It was affordable. The traditional justice system in Liberia promotes community reconciliation. The kind of Western system of justice is adversarial. And so the Liberians told us they really wanted to hold on to their customary system of justice, but they wanted it improved. They said that, too many chiefs didn't treat women fairly, and too many chiefs used torture to resolve disputes. The program we designed, in partnership with Liberians, was to identify the best chiefs in Liberia, the ones who were resolving cases, in a fair manner without using torture, treating women well. And then we went around the country with those chiefs, and so those chiefs would teach other chiefs. By finding the top chiefs and bringing them around to their colleagues. We saw great results. I mean, the chiefs loved it. I mean, you rarely would meet chiefs in other villages because traveling in Liberia was so difficult. There was no road system to speak of. There's no electricity in the country. There's no running water in the country. And so when you would bring a chief from one part of the country to another part of the country, it was a big deal. They would welcome, the visiting chief, and they'd welcome the Carter Center. And it was a big moment in that town. And so you certainly had the attention and respect of the villagers, and they would really be committed to, whatever it was that you were there to talk to them about. And so I've taken a lot away from that and applied it to my work now. I mean, number one is, and this applies in just my entire life, not just in my job as a prosecutor, the thought that someone with a low income, the thought that they are lazy is ridiculous. I mean, people of low income work harder than anyone. The Liberian people I met, even though there was 85% poverty there, they were the hardest working people I've ever met in my life because they are scratching and clawing for every single thing they have. Now, when I'm prosecuting and I see a single mom with, 3 kids who's struggling, I know that she's might be taking, 3 bus lines to work her minimum wage job before she can go home and work her other minimum wage job. And so the empathy that I have now, that's partially based on my work in Liberia, I think makes me a more effective prosecutor.
Well, and John, that certainly drives home that many times we think things are bad here in the United States, and struggles and difficulties. For you to say there's no roads, no water, yet one of the tenets and one of the things that if the society is going to live and thrive is there's got to be some law and order. There has to be some method to keep things moving. So taking your Liberian experience, and I think you also were a defense practitioner, you became DA, you saw some issues. What did you do? Tell us a little bit about your program. I believe it's referred to as Goldilocks.
Yeah, well, thanks, Dave. When I was elected, a lot of times, this is kind of the new thing, right? The progressive district attorney, right? It's you run a campaign and you say about all the great things you're going to do, and then you win and you say, oh shoot, like how do I do this? Like you're the dog that caught the car. And so what I did was I brought our community together and I asked the question. I created an advisor group, and I asked them, hey, how can we make Deschutes County as safe as possible? And over a 18-month period of time, we ended up developing the Goldilocks Program. And I'll talk about one component of it. And it's this: people who are arrested in Deschutes County for possession of small amounts of drugs, what we were doing wasn't working. The recidivism rate was through the roof, over 50%, and people were having difficulty getting housing and a job because of the convictions we saddled them with. And then the treatment we referred them to wasn't effective. So we had to come up with a new way. And here's the new way. What happens now is a police officer encounters someone on the street they suspect of possessing drugs. They, rather than arresting them, they issue them a citation to appear in court. That citation is for a date, usually 4 to 6 weeks out. And then the cop tells them, hey, you might be eligible for the DA's new program. Here's a card with information about it. If you're interested, show up on Friday at 11 o'clock for an orientation. Now, our numbers don't justify holding a meeting every Friday, but we were thinking, we didn't want the cop to say, show up on the 3rd, Friday of the month, or the 2nd, Friday of the month. That was too complicated. So we just wanted to make it as easy as possible for the officer and the suspect. So show up on Friday if you're interested. Here's a card with info. And here's a bus pass in case you have difficulty getting there. And then my office will call people to remind them about it. And this is a voluntary program. If the person shows up at the orientation, I'm there, a public defender is there, and a drug and alcohol professional is there. I welcome them, tell them about the program. If they're interested after hearing from me, they'll have a confidential meeting with the defense attorney. If they're still interested, then they go to the next room where they're immediately assessed, for their drug and alcohol needs. And then if they score out low risk, low needs based on that assessment, that's it. The citation's ripped up. We wish them well. They don't have to do anything else. If they are something other than low risk, low needs, we schedule a medical appointment for them. And this is a very important part of the program. We don't refer them to drug treatment because we know that not everyone who possesses drugs is someone who lives with a substance use disorder. Not everyone who has a beer is someone who's, an alcoholic. But for years in the criminal justice system, judges, defense attorneys, and prosecutors have been effectively diagnosing people. We say you have a substance use disorder, and our prescribed course of treatment is to send you to this, drug and alcohol treatment provider. So that's ridiculous. So we refer them to a medical doctor, a primary care doctor. We make that appointment, and then we call to make sure they show up for that appointment. If they show up for that appointment, the case is pulled out of court, and then they're in treatment for a year. And what's the treatment? Well, it's up to the doctor. I'm not a doctor. The doctor's going to start with the physical. They might tell their patient, hey, you're the healthiest patient I've seen in a year. I don't need to see my healthy patients often. Come back in 6 months. The doctor might say, hey, you have diabetes. Did you know that? Let's get you help for that. Doctor might say, hey, you have cancer. I think you have cancer. Let's get you to an oncologist. The doctor might say, hey, I think you may have a substance use disorder. Let's get you help for that. The doctor may say, hey, I think you could benefit from talking to someone about your mental health. Let's get you help for that. The idea is it's a primary care doctor who is managing that care with their patient, and they're making their own decisions. I don't know anything about that. I don't require a waiver of patient-doctor confidentiality. I don't know anything about that. The only thing I require is there's one agreement that if the patient stops participating in their care, they stop showing up, the primary care doctor will inform me and say, hey, my patient has fallen out of care. If that happens, we put the case back into court. And at the end of the year, though, if then the primary care doctor will write me a letter saying one of two things. My patient has participated in their care or they have not. And I don't care. Care is not the right word. It doesn't matter to me if the person used a few times during this year. This is a harm reduction model. If this person was using meth on a daily basis for 6 months, and if they move to using meth once or twice a month, that's wonderful for that person. It's wonderful for their family, and it's wonderful for community safety. I consider that a win. The criminal justice system would consider that a failure. And so we've seen great results for this program, great results for individuals. Lives have been saved, and we've seen wonderful recidivism reduction numbers. Maybe we can pull up the infograph, Jesse. Yeah, I think there's way too many words to, meaningfully talk about this now, but you can go back and look at the recording later or contact me and I can email this to you. But a couple of things I'm going to pull out here. On the upper corner, right corner, you'll see the 1-year recidivism rate. Criminal justice system, Deschutes County criminal justice system handling possessing cases in the court, the old school way, recidivism rate 53%. Our model, 35%. Now, hey, I'm not saying 35% is great. We're looking at making this program better. We want to improve our work on helping people find housing and employment, and we think that would reduce that number. But a drop from 53% to 35%, we're pretty proud of that. And saved court appearances, you'll see, actually, this is a little outdated now. I got to update my numbers, but you'll see 333 saved court appearances. We estimate that's up to 700 saved court appearances now, and the court really appreciates that. And at the very bottom, chronic health issues. We certainly knew we'd see people struggling with alcohol and drugs and mental health issues, and we see that. But look at this. We got over 12% of people have hypertension, 14% Hep C, 16% asthma, and you'll see the diabetes and people with cancer. I'm not someone who is, and Jesse, you can pull the chart down. I'm not someone who is in recovery. And so I have to lean on my friends in recovery and lean on the literature and look to the professionals to understand as well as possible what it's like to be in recovery. But I can imagine this. If I was in recovery and I had untreated hypertension or untreated diabetes or untreated gout or untreated cancer, it would be really difficult for me to focus on my recovery. And so the idea that when you go through the court system, We diagnose you as having a substance use disorder, send you to drug treatment, and don't get you help for all of your other medical conditions. And we expect you to focus on your recovery and do well in it. Strikes me as foolhardy. So what I love about this program, I'm wholly biased, of course, I designed this program, but what I love about it is it's quick entry into medical treatment. And we have a primary care doctor who is overseeing the care. I don't want a primary care doctor giving me legal advice, and I shouldn't be giving medical advice. So that's a quick overview. We can talk more about it, Dave, throughout the day. Thank you.
No, that absolutely. The one question I think for many is you're talking about doctors and physicians and medical service. How in the world do you pay for that?
Yeah, it's easy and overwhelming, right? It's overwhelming if you live in a state that did not expand Medicaid under the Affordable Care Act, Obamacare, right back then. When I started this program, Obamacare had recently been enacted, and Oregon had, availed itself of that program. And so what you have is now this gets a little interesting. We looked back retrospectively in the previous year. We wanted to know if the people we were prosecuting for drug offenses would be eligible for Medicaid. And we used a proxy for eligibility, whether they qualified for a public defender, because in Oregon, the eligibility was almost the same. And we found that about 95% of the people we prosecuted for drug offenses had a public defender, so they would be eligible for Medicaid. Now that begs the question, we know people of low income don't use drugs at a higher rate than people of higher income. So why are they making up 95% of the drug cases? Now that's a policing issue that maybe we can talk about that in another webinar. But for purposes of this program, we knew that the people who would be getting arrested for drug offenses would be eligible for Oregon's Medicaid program. So then it became a capacity issue. I went to our local, two of our local clinics, our federally qualified health centers in Deschutes County. And I asked them, I said, hey, if I refer you, 300 cases a year of people with insurance, would you be able to handle them? Oh, and if I refer you 3 a year or 4 a year of people without insurance, would you just do that for free? And they said, yeah, sure, we've got the capacity, because they had built out because of the Medicaid expansion. They knew there'd be new patients in Oregon, so they had just expanded their clinics. So the timing was perfect. It actually worked well for them. And so the doctors bill Medicaid. These are patients who come to them with insurance. So the doctors bill insurance. Worked out great.
And John, the audience is starting to come alive. Quick question for you. What about co-occurring? And specifically, the question was about mental health issues. Primary care physicians okay with diagnosing and working with those issues as well?
Yeah, the primary care providers are the care coordinators in this situation. They're referring to specialists. And that's what I love about working with the federally qualified health centers. I imagine maybe most people on this call are lawyers or police officers or other criminal justice professionals. They may not know about the federally qualified health centers. Every community in the United States has a federally qualified health center, also known as a community health center. These are created by Congress, and the mission of these organizations is to provide care for the underserved. And so they are the experts on care coordination, creating care teams, working primarily with people of low income, so they understand the populations that often get caught up in the criminal justice system. So that doctor will refer to a mental health professional who oftentimes is within the federally qualified health center. In the bigger ones, in the smaller federally qualified health centers, they'll refer out to other providers who will also bill insurance. Now, we have 2 federally qualified health centers in Oregon. One of them does most of the care in-house. They have mental health professionals and drug and alcohol professionals on staff. The other one is in a smaller clinic in a smaller part of the state. They have a good referral network. They'll refer out of their office, but whoever they refer to bills Medicaid.
Excellent. And Jesse, did you tell me earlier that we can open mics?
Yes, sir.
I see my friend Emily Janes here from LA, a very strong victim advocate. I'm sure she has questions, especially working in DV and getting help for some of her clients. Can we see if Emily has some questions or thoughts?
She is live.
Sure. Hi, thank you, David. I guess the thought that comes to me is going to be the one that I hear most often is, if this help is available to the defendants in the case, is there help for the victims? I fully agree that I think this is a fabulous step towards getting to the heart of what causes a lot of these issues. But I think a lot of times the victims in the cases are going to be equally needing support in this area. And so I'm wondering, sort of, is that incorporated?
Great. It's a great question. My program that we're talking about, it's only for drug possession cases. So there's no victim other than the defendant and their family. But the bigger question, and when we talk about deflection programs in general, particularly ones with victims, I'll take that on. I'm a huge advocate of the federally qualified health centers. The story that was not in my intro bio, I did work for the Carter Center for a few years, but I also worked as the state policy director for Oregon's federally qualified health centers. So they're near and dear to my heart. And what we will often do here in my office is refer victims of crime to the federally qualified health centers, the FQHCs, we call them, because they have a mission. Their certification that they receive through Congress requires that they provide care to everyone who walks in their door, regardless of their ability to pay. So if someone is on Medicaid, they'll bill Medicaid. If someone's not on Medicaid, they will enroll them in Medicaid if they're eligible. And if they're not on Medicaid and they're not eligible for Medicaid, which would be very few people in Oregon who are not eligible, then they represent them for free. So if you have a federally qualified health center in your community, I've been telling everyone in the criminal justice system about this. I think only maybe a few people listen to me, but get to know your federally qualified health center in your community. All victims advocates offices should go for a visit, ask for a tour there, and learn about their services. So absolutely, you can refer victims to your local FQHC.
All right, and we're going to get to Melissa, I promise. But John, they're coming at you now. First is a structural question. Is this considered a pre-arrest diversion? And then the other piece is the question about, is the citation public information or is it confidential? Do you hold on to it and destroy it before it hits the court system?
It's a great question. We worked a lot with the defense bar and the Oregon State Police on their criminal justice database systems. And these citations are not entered into the state database. So if you run someone's record, it's not entered. And the key was we had to, in designing these programs, you have to think about all these things. How the citation works in Oregon, at least. The officer writes the citation, sends it to my office. I review it and decide whether to put that citation into court. If I put it into court, so I'm actually filing the citation in court. If I put it into court, then it appears on any record that someone would run. So I hold it to see if the person wants to enter the program. And if they do they show up for that first doctor's appointment? If they do, I've never put it into court. If they don't, then I put it into court and then it would show up. So it's a little hybrid. Is it pre-charge? Well, I mean, the officer has written the ticket, but if a tree falls in the forest, so I would say it is pre-charged because it's not showing up anywhere as a charge.
Excellent. And then Jesse, let's open one more mic. Jody has a question. The question that was presented to us is, do you have any advice on how to get a county prosecuting attorney to consider such a model? So I think for the audience to realize you are at the county level, but I have a feeling Jody's probably at the city attorney level, and there may be some noise with what the city attorney's doing versus what the county attorney might be doing. So Jody, can you enlighten us? And we do have a county prosecutor here.
Yeah, thanks so much. Actually, I'm not an attorney. I work for community mental health in a jurisdiction where we have a new prosecutor, and we're really excited about the prospect of what this could mean. And so, we're looking at just building a partnership with our prosecutor, and we'd like to do it in a way that's meaningful for the prosecuting attorney's office, but also for the community. So I just wondered if you had any, I see the infographic and the information. I think that's fantastic. And I just wondered if you had any other advice on, what's the selling point for this and how can we get our prosecuting attorney excited about it and on board with it?
Okay. Yeah. So Jody, before John answers, please put your information in the chat box or send it to Marlene. We are more than ready to help with your prosecutor, especially a newly elected prosecutor.
Wow.
To
Okay. Thank you.
See how can we expand. And now let's go to John. And I see Melissa nodding also. So Melissa's also at the county level, and we're going to get to her. She probably has some thoughts also. How do you engage? How do you expand?
Jody,
So
thanks
John?
for that question. I
Yeah.
mean, the key to me, I think, is to focus on the problem first rather than the solution first. And and that's kind of what we did here. I came in, with the progressive district attorney chops and that I'm doing this progressive DA stuff. But what does that mean, right? And so we looked at what the reality was in our county. I think recidivism rates are a good thing to look at, but you wouldn't necessarily have to look at that. We looked at recidivism rates, and then when we saw how abysmal they were for drug offenses, that allowed me to go to some skeptical people, such as law enforcement and judges primarily, and deputy district attorneys in my office, and said to them, hey, doesn't matter what your philosophy on this is, right? Well, it matters, but let's put that aside for a minute. What we're doing now isn't working, right? Even if in your heart of hearts, you want that to be the way, you want a tough on crime way to be the way, it's not working. And then I could just say to them, are you happy with 55% recidivism numbers? Everyone said no. Of course, you would have to say no. So everyone said no. I'm like, okay, well, if you're not happy with the results, let's talk about how we can get better results. And then we got together and we created this. And so I'm confident. I don't know what your recidivism rates are there. If they're great, well, you probably shouldn't change it. I don't know, right? Maybe, but if they're not good, and I suspect they're not, then that gives you an opportunity to come together and say, how can we do better? Now, it's not gaming the system per se, because maybe there's a really tough on crime way to reduce drug recidivism that I'm not aware of. And maybe in that conversation, that'll come to light. I suspect it won't, because all the data, all the research, all the experts say that if you want to reduce recidivism for drug offenses, you have to take a medical approach, not a criminal justice approach. But don't have that as the outcome. Just say, we're not happy with these recidivism numbers. If you're not happy with them, let's all come together and talk about how we can do better. And then you let the science and the data and your unique needs of your community drive the design of your new intervention. So I'd take it that way.
Awesome. Yeah. Thank you. Thank you so much. I really appreciate that advice.
And John, I think there's plenty of problems out there. We don't need solutions in looking for something that's not a problem. And also you do need to push your progressiveness a little bit. You don't look like this crazy guy from Bend, Oregon. For those of us that knows Deschutes County, we think of beer.
I'll tell you, it helps. I'm not, I think I know you're kidding a little bit, Dave, but I mean, I think it does matter how you package it, right? If you package these ideas as, we're doing it for social justice reasons, that might fly in Portland or, in Burlington, Vermont. But, I package it as this is about, public safety. If you help people, well, in my heart, I'm glad I'm helping individuals, but we're also helping our community because healthy people are not out there committing offenses. So I focus on how it makes our community safer. And I talk to my friends about how much it makes me feel good about saving lives.
That's outstanding. Okay, Jesse, can we hear a little bit about Melissa?
Many of us, especially in recovery or working in this field, might not self-disclose that we do that. But so sometimes we're hiding in plain sight. But if you're looking for us, we're out there. There is a young man, he's openly in recovery too, who actually went through our local drug court program, went to law school, became an attorney, and is doing the same type of work. I'm a person in long-term recovery from drugs and alcohol since 2011. While I was getting into recovery, I decided that the route I wanted to take with my career was going to be a lawyer, more specifically a prosecutor. And for the last approximately 2.5 years, I've been working in the Superior Court of New Jersey as an assistant prosecutor, mostly focusing on individuals who have substance use disorders. Those people who were just like me and that I really felt like I could make a difference, meeting them when they reached the court, working on many deflection and diversion programs, training law enforcement officers, training peer recovery specialists. I love to tell a story where one of the prosecutors that worked in my office told to his class, he had actually asked me to come speak at a class that he was teaching at a local college. And he said to them, when I got the email that Melissa was starting at the prosecutor's office, my initial reaction was I had spent my entire career putting people like her in jail. And he's like, I asked her to come speak to you today because after knowing her, I realized how valuable she is to not only the community that is lawyers, but to the community that is law enforcement. So I think that's a perfect example because most people are kind of skeptical because they don't get to see the positives of somebody in recovery. They don't get to see that we do recover and that we have something beneficial to bring to the community. Although some of the resistance was disheartening in the beginning, and sometimes even to this day, when I intercept somebody who's been working in law enforcement for a very long time and isn't open to this kind of new wave of deflection and diversion, I know that once I'm able to kind of break through that outer shell, I'm really able to make a change in that person's life and then the lives of the people that they interact with out in the community. When I'm training a department of officers and I have a few hours to really break down some of these ideas around harm reduction or community policing and how we're kind of moving forward, that's where I see quickly their ideas shifting. When I'm talking on a webinar like this, I think people get the same takeaway, but the one-to-one, like this person is right in front of you. She works at your local prosecutor's office. She's running the programs that you're utilizing, really makes an impact on the people that sometimes we think are never going to be able to shift into this new idea of how we do our jobs as prosecutors, as law enforcement officers. And the funny thing is, I hear all the time, you're like one in a million, where did you come from? But if you look, we're out there.
And Melissa, I'm so pleased that you're coming behind John. John talked about the fact he did not have an addiction or substance abuse, but had the kind of medical as far as funding, availability, and such. And what a beautiful thing that you're coming now behind him and talk about your program being someone who has that sort of lived experience. And I think the other thing for the audience is he's the elected, you're an assistant prosecutor. How do you build something? How do you get, and remember the earlier question about how do you get your boss to say that, yeah, this is a really good idea. Melissa, I'll follow you. But I think most importantly, right away, your conversation about, you're one of those people, instead of being our folks, our victims, our members of our community. So take it away. Please tell the audience a touch about what you've been able to accomplish.
Thank you again. This discussion already has been amazing. This type of work, deflection and diversion, is so important to me, and to hear about John's program and to hear some of the questions really gets me fired up because 5 years ago, Melissa, coming out of law school, figuring out, how she was going to do all this stuff, didn't know how easy this was going to be once you got connected with the people who are doing this work. And so if you're on this webinar, if you're participating, if you're listening to John, Dave, and I, and the other individuals who are asking questions, all of this information is out here. For me, like Dave said, I'm an assistant prosecutor. So I was appointed by Prosecutor Scott Kafina down in Burlington County. And at the time that I came into the office, he had started implementing a program more readily known as an ANGEL program here in Burlington County. It's called Straight to Treatment, where we were putting providers, substance use providers, as well as recovery coaches in police departments for people to self-refer themselves into the program to get help. Most of the time that help is going into a detox or some sort of treatment setting. When he got my application, it also kind of worked out in a way where we were also getting funding through Attorney General Gruel through a program called Operation Helping Hands, where every county in New Jersey was given an amount of money where we could implement different law enforcement initiated programs to help people with substance use disorders. And so being able to grow that program that he started, that straight to treatment program in the police departments, from one department to 4 on almost every day of the week, and then also really begin to brainstorm on how we were going to do this active outreach. We brought together stakeholders, and we heard, like, how do we start these programs within the community? And what we started to do was really just bring people to the table, not wait for everybody to jump on board, but simply start throwing around ideas, put stakeholders in place, have conversations with departments, get in touch with the recovery community, which I think was a little bit easier for myself because I am part of that recovery community as a woman in recovery, abstinence-based recovery since 2011 from drugs and alcohol, bringing on a project manager to help us, work through the grant funding, and who was also in recovery to bring his voice. We were able to really build the program that we needed within our community. And that's the thing about deflection and diversion. And if you're trying to start a program from scratch, you can fit it to whatever community that you need. The traditional Operation Helping Hands model within New Jersey was really going into open air drug markets and intercepting people who were buying drugs and then connecting them to services. Here in Burlington County, that didn't work. We don't have an open air drug market. We are the largest area-wise county in New Jersey, but we sit right between Trenton, Philly, and Atlantic City. So we have major highways. We have the Turnpike and we have the Parkway running through. So that was not going to work for us. So we did similar to what John did, was assess the situation within Burlington County. And what we saw right off the bat was that our fatal overdoses from opioids and fentanyl were astronomical. We were losing approximately 160 people a year to fatal overdoses. And so we decided that the model that we wanted to take was 24/7 responses by recovery coaches out to the scene, meaning that any of the police departments, and we have 30 plus police departments within the county, plus state police, meaning that any of those officers, if it was 1 o'clock in the afternoon or 3 o'clock in the morning, if they had an overdose, they could call a peer recovery coach to dispatch out to the scene to give that person those critical services, either a connection to a recovery coach for peer recovery coaching, or access to treatment through our very skilled and dedicated recovery coaches. As the program began to unfold, as we got more grant funding, we not only responded out to overdoses, but we responded out to any call from a law enforcement officer, including arrest or non-arrest, when the officer felt like that person could benefit from a recovery coach and from recovery services. And so we began dispatching 24/7, and the longest stretch we've had to date is actually now. We started up again in the midst of the pandemic. So in May of 2020, and we've been running 24/7, 7 days a week, nights, weekends, holidays in our county, really being able to get people at that critical time. the help that they need. And so as I was listening to John, the way that they use medical doctors, we have been using peer recovery specialists, those people with lived experience who have gone through training, who are going out to the scene saying, listen, I'm not forcing you to do anything. I'm here to offer you services. If you don't want it, that's fine. Here's my phone number if you want to contact us in the future, but I'm here to help you. There's actually, so SAMHSA has a definition of what recovery is, and it says reaching one's full potential through a process of change that improves one's health and wellness and enables them to live a self-directed life. And so that's what we're trying to do with our recovery coaches. We're not forcing upon them abstinence. We're not forcing upon them treatment. Sometimes our coaches are simply removing barriers, helping them get identification, helping them get access to social services, helping them get the things that they need that might improve their quality of life, and letting the participants that we work with really define what recovery is to them. And we found that really effective. Since May 1st of 2020 up until March 31st of 2021, we've had 274 calls by officers. As like a general number, 80% of the people that we were able to make contact with accepted recovery coaching, meaning, not all of them went to treatment, but all of them had consented to continuing having contact with that coach that went out to them. And then 44% of the people that we coached went out to treatment. So they went to detox, they enrolled in IOP or outpatient services. So again, we found this to be really effective, meeting people where they're at, if that's in a police department after being arrested, if it's out on the street when the officers are just out and about doing their daily job, or just any other interaction that they're having with law enforcement. I wanted to just touch upon a few things. For us, our program, although our Operation Helping Hands program is usually for individuals, any individual that we meet, something that we wanted to do was be inclusive. So somebody had asked a question like, what about victims? And for us, we really wanted to not just have it be for defendants. We didn't want people to be reached at just that acute point of arrest or even that acute point of overdose. And we really wanted to make a culture of recovery from, perhaps just an officer walking down the street and talking to an individual, even escalating up to that point of arrest, and really make it available. And I think once you implement that culture of recovery within an office, within a department, within a community, you see that you'll get phone calls. And so anybody in my office, anybody in my community knows that if they pick up the phone, if they call that 24/7 hotline to get that recovery coach out there, they try to contact me, we are going to give anybody the services that we have. And we're very lucky to do that. I am just really grateful to be part of this conversation because, I know that it's difficult out there to find resources, but PTAC is one of those places where I came early on to figure out how other people did it and to incorporate those things that are going to work into what our program is today.
Well, I think that's the great thing about us as attorneys and the law enforcement crowd. We do plagiarize, we steal from each other, we listen and say, okay, well, if it works there, why not? Why should we try it? Or take a chance with it. I think one of the keys, especially coming on your video, is your training of law enforcement. And you talked about reaching out. I think you have 30 plus departments. And from those of us that came from counties with a lot of departments, it's hard to get that cooperation and the logistics to get the crowd you did. Do you feel like that training is one of the ways that gave you that insight and inroad? What would you share to others if they were trying to work with your agencies, especially if they have a lot of agencies?
Sure. So the helpful thing is, obviously the prosecutor putting out directives all down to those departments is very helpful. Obviously, this is a voluntary program. They don't have to call, but it definitely helps. Also, that boots on the ground going out and training outside of COVID, I was doing in-service trainings for officers, not substantially long trainings, but going out and giving them just a rundown on Addiction 101, chronic brain disease, what is harm reduction, what is medically assisted treatment, what is the cycle of change, what are we looking at when we're dealing with individuals. And I found that the departments have been really receptive, and most people understand we're not going to arrest our way out of the problem. They know they're frustrated when they respond to scenes, and they had just given Narcan to this individual a few days prior. They want solutions, and so being able to go out and directly train them has been helpful. We've incorporated this into law enforcement CIT training. So I go out and I train not only individual departments, but an array of officers who are showing up for that CIT training, partnering it up with those mental health services and other programs. And then on the other side of that, during COVID, we really needed to kind of pivot. So we put out a recorded training on language training, how to interact with those with substance use disorders, had people speak about their personal experience, had an officer who's worked closely with our program really break down how his mind has shifted from an arrest-based model to more of that community policing and more of that, how do I serve my community and how do I serve this particular population? And so that made it really easy, because that 15-minute video was blasted out to everybody, over 900 officers within the county. And so if they showed it at roll call, they could do that. If they were sitting in their police cars, they could do that. And so again, that was very helpful during COVID, when the in-person trainings really came to that standstill.
And I think
Dave, can I jump in here? Dave?
Oh,
well,
yeah.
I'll start early. Oh, sure, John, by all means.
Melissa, I love what I'm hearing there, because I would say a misstep. Lessons learned, by doing it the wrong way here. I focused early on in my program on educating the chiefs and the captains, who are important, of course. If you don't have them, it ain't happening. But I naively assumed that, once they were fully on board, they would push it down. And wow, the power of the patrol officer is massive. And if you're a district attorney and don't appreciate that, you're going to have trouble. And so I love how you focusing on patrol officers. And I also loved how you didn't just train them on your program, you trained them on like the brain science and why your program was important. And I neglected that. And so I'm going to ask you to send me some of your videos and see if I can steal some of your ideas on that. Good work.
And John, that was a perfect jump in, because that's where I was going to go back to Melissa and also our audience. There is a little bit of New Jersey envy about the prosecutor sends out the memo and they are the chief law enforcement officer. See the smile there, and this will happen. I think, John, you're New Jersey is one of the few that is a top down instead of a bottom up. But
well,
yeah,
I think it happened because Melissa was out there, talking to him. I don't know if it would have happened without Melissa.
Oh yeah, because that's exactly what you put forward to the audience. So it's fine to get the chiefs and captains, right? Even if they sign off, is it really going to happen? But the other thing, Melissa, is I was not accurate about not knowing where your county is. I have ridden the Tour de Shore a few times. There's a bike ride for police family members, victims, from Philly to Atlantic City. So I know it's 70 plus miles. You do have a big county. And I know by pedaling a bicycle that distance, you've got a lot of ground to cover. So for the audience, I misspoke now that I realize where it's at. But I think that very much is that nuance. And I think with both of you, I wanted you to get to the crosstalk and ask that kind of question. But we had a couple questions from the audience. We've talked a lot right now on drug cases. Have you thought about what we can do beyond possession of controlled substances, overdoses? Can these programs, or Melissa's, yours might be too specific, but it could be all some kind of cases, right, of which the individual is involved. And then for you, John, are you looking to, how do we, what other cases might you be able to be involved? So whoever wants to take it, fire away.
I'm jumping in first. Yeah, a big driver behind this program was when we looked at the data, you know, we saw that a large percentage of people who were charged with possession cases were also charged with theft cases. Now, I know it's kind of a truism in criminal justice. We all say, yeah, people who are, you know, are possessing drugs are also committing thefts, but I never actually saw data on that. So I didn't believe it till I saw it. So we did a deep dive on the numbers, and it was pretty striking how many people who were charged with drug offenses were also charged with theft offenses on the same day, on the same day, right? But then if you looked over a year, there was tremendous overlap. So we thought that if we help people address their addiction to drugs, that we'd also see a reduction in theft recidivism. But we weren't prepared yet. I wasn't prepared to roll this program out to, you know, offer non-prosecutions on non-drug offenses. And that's primarily because I didn't want to get too far ahead of my community, our law enforcement. I knew that we had a tenuous support of law enforcement early. I had to work hard to get the support that I got. And so I figured, well, let's take what we can get. Let's have a proof of concept. If we can show that we can significantly move the recidivism needle on drug offenses, well, then maybe we roll it out into other offenses. And so we're getting near that point where I think we're going to talk about rolling it out to other offenses. But I just think you got to, right? You're not a leader if no one's following. So you got to, I mean, you want an elected district attorney, I think, to push their community and pull their community a bit. But if you get too far, then you're talking to yourself. And so I thought when I came on board 7 years ago that this was as far as we could go. But I think now that we've shown it works, my community and law enforcement would be ready to go a little farther. And I could talk for hours about other programs we have in mind, but I don't want to monopolize this call. So
okay,
Melissa,
let's hear from Melissa.
Yeah, so for us, using that kind of bottom-up method of letting the patrol officers make the decision has been really helpful. They're out on the street. They know these individuals. They know who needs the assistance. So basically the only caveat given to them in the arrest portion of the program is we really wanted to exclude violent offenders. So doesn't mean that those people couldn't get services, but that encompassed people who were committing thefts, committing shopliftings, trespassing, really all of these offenses that touch and concern someone who's using substances. And what we found is that the officers were able to identify these individuals, engage these individuals, and really make those phone calls to the recovery coaches with that warm handoff. And that we really didn't need to say much more. You know, our patrol officers, our officers out on the street have tremendous insight into their communities. So letting them use that insight was really helpful. And I think, you know, to just touch on something John said, you know, yes, I do all these deflection and diversion programs, but I also, as an assistant prosecutor, like have a case list. I'm the drug court prosecutor. I'm indicting cases. So being able to interface with these officers, ask them why I'm not getting calls from their community, ask them what the holdbacks are, ask them, you know, how we can improve the program has been a significant benefit. You know, just last week, I had a detective come in for grand jury, and I was like, you know, I see that there's a decrease in calls from your jurisdiction when it used to be one of our highest. Why is that? And be able to see that insight. And, you know, there's a lot of things that play into that. But that has been helpful. People might think, oh, it's still just for overdoses. Again, or they might think that it's just for people who are arrested, and letting them know that this program has really blossomed into anybody that they believe would benefit from the services.
All right. The next question I see coming in here is, and I'll just read it because it's pretty self-explanatory. I'm a prosecutor in a rural county with a college town. Current gap need is program for repeat offenders whose primary issue is significant mental health problems with often secondary issue of substance abuse, alcohol use, usually nonviolent, theft, trespass, harassment. Anyone, have a program already? Would John's program be able to adapt to mental health? And I think for both of you, the co-occurring, right? Isn't that the most common versus just a pure substance issue? But I also wanted to throw out that a couple of the large offices with large universities have been able to work with programs for students, because many times the universities have control of that student's life, and the university can get the student to do things, and then especially if you get the parents involved, it's an extraordinary kind of leverage point to get them to address some of their issues. I was going to throw out East Baton Rouge is working very closely with LSU, and then Pima County, Pima, Arizona, Tucson, U of A. So I think with Arizona, after they recover from losing the national championship game on the women's side, they'll get back to work. It looks like Melissa probably was watching the game, but anyway, does anyone, Melissa, do you want to take it first, or John? And I don't know if you've got colleges. What do you do?
So we actually do have college. It's mostly a commuter college, Rowan College in our county. And again, we developed relationships with the programs, with the professors, with the counseling centers, just to make sure that we were having an open dialogue with what they need. As for different programs, Dave just gave you a whole bunch of different programs that are up and running, but I was in the same place as you, looking, how do I adapt these programs? I think John's program would definitely be adaptable to the population that you are talking about in your question, but also I see that Leslie posted the PTAC website in the chat. That's where I learned about the 5 different pathways to diversion and deflection, learned about all of the great work that's going on around the nation and how people have been able to adapt these programs. And then again, like begged, borrowed, and stole their stuff to make the program fit to my community. With someone who has mental health and substance use, I think that medical component John's program has is certainly beneficial, but even our program, the 24/7 operation, or having another quick response team, as long as you comprise the team and the responders with someone who specializes in mental health, I think you would be able to adapt even a 24/7 response team model as well.
Yeah, I agree, Melissa. It's like in our program in Deschutes County, 57% of the people in the program are identified as living with mental health disorder. But I'm learning on this call. I love this. I have to show my humility a bit. I think we sold ourselves a little short by waiting for someone to commit a crime before we got them the help. That's what I'm loving about Melissa's program. And so we're getting people in our program who are living with a mental health disorder, but only when they commit a drug offense. Why don't we get them help before they commit a crime, right? And so, but if we did, how they enter the program is one thing, but what you do for them when they're in the program, that can be the same, throughout. So we know how to help people who are living with a mental health disorder. And I'm going to actually be, talking to my team about maybe opening up our eligibility and not waiting for someone to commit an offense. But I'm going to, maybe some people got on this call late, so I'm going to just say the thing that I say to everyone. Check with your federally qualified health center. Find out who your federally qualified health center is. Get on Google, federally qualified health center, enter your location. You're going to have one in your community. Head over there and ask for a meeting and get an orientation on what they do. And talk to them about the services they provide to, people who are living with a mental health disorder, and see if you can partner with them. And I'm sure they'd be interested. They rarely hear from people in the criminal justice system. They were super excited when I reached out to them. So I encourage you to do that.
Yeah. The other thing that I put in the chat There's a book that actually came out on early prosecutor decision making. I put the link to the PDF. John and I actually had the opportunity to share about our programs in that book, but there's tons of other people and prosecutors around the state who talked about their programs. So if you're looking for people to go to in the different models, like that's another resource that you can use. And most of the people and their offices or departments are so willing to help people get these types of programs because they see the impact that it's had not only on culture of law enforcement, but in building communities.
And Jesse, I think if we can open up Drew's mic, because his question was that about data. He was more pointed towards John and his program, but I think data and disparities are something we have to worry about. You know, you got a program for the white people, but what about others? Drew, Jesse, can you open his mic? And Drew, do you have some thoughts on what we should be doing or questions?
I think my question might have gotten mixed up with another question. Mine was specifically to John, how he was managing these citations before referring them out. Are you using a program or portal, or are you just using like an Excel spreadsheet?
Yeah, good question. We use Prosecutor by Carpel, which many prosecutors' offices in the country use. It's a case management program. We've got a IT whiz in our office who's done some modifications to the out of the box program. And we code when a case comes in, we code it as a clean slate case. We assign it to one of two attorneys who handle these cases, so they know what to do. And then we also have a staff member who makes the phone calls, the reminder calls to these people who are eligible, to encourage them to come to the orientation session. And so we've got a calendar, tickle to pop up, with our deadlines. And so that program has made a huge difference. We tried it for a few months without putting the cases in there, and that didn't work so well. But when someone successfully completes the program, we purge the file, because there's two aspects to whether they're going to have a clean record, right? The number one is any potential employer or housing agency run a background check on you, and so that's like 99% of problems people might have. And so by what I said earlier was by not putting that citation into court, we avoid that problem. But if we're maintaining records in my office, anyone can make a public records request to my office. I mean, it'd have to really be out to get someone like, I wonder, I ran that person's background check, it didn't show up, but let me just make a public records request to the DA's office to see if the DA has something that didn't show up. That's pretty speculative. It probably won't happen, but we still purge those files, that we have them on a 1-year purge schedule. We're complying with the state of Oregon's record processing system. So make sure you comply with that. Every state's different. But so yeah, we use the Prosecutor by Carpel system.
Thank you, John.
Melissa, any thoughts about keeping records? And does anyone want to address whether we're testing it for things like racial disparities?
Sure. So I know here in Burlington County, we don't have a system, but we do collect intake forms. We collect spreadsheets of all of our data. We think that's really important in being able to provide not only the person providing us the grant, but our community, the results of the programs that we're implementing. So we do that. Something over the last year and with COVID, we've really been able to take a critical eye to it, is looking at the populations that we're serving. So again, making sure that maybe, our more rural communities aren't getting the most calls, and maybe our urban communities are also receiving those calls, but also tracking data on sex, gender, any socioeconomic background. I think the information is still out. We're looking at that data closely, though, to make sure that everyone who wants recovery can get it through our program. And we try to address pretty flat out. You know, we don't want to give people recovery who deserve it. We want to give recovery to the people who want it. And so being able to really make those officers able to give it to anyone they encounter, no matter what their background is really important to us here in Burlington County.
Dave, I'll add on to that. It's a great question. And I touched on earlier that there's an issue of, you know, policing overrepresents people in the criminal justice system relative to their use of drugs. And that's a huge issue that, you know, is beyond the scope of this call. But at least for the people who the police are identifying, I want to ensure that the people who enter into my program are, we're not pulling a subset out of the people who are identified by police. And early on we were, and here's why. We make these reminder phone calls to people. Well, if you don't have a phone or your phone's been disconnected because you weren't able to pay your cell phone bill, you're not going to be getting the reminder call. And someone who's more well-to-do will get that reminder call and will show up for the orientation. And so we were seeing that was an issue. And so what happened was, then once someone shows up for court, remember they got that citation, the cop gave them a citation, they didn't get a reminder call to show up for our deflection program. So then they show up in court on that citation. And then we would try to, at that point, then they get a public defender assigned to them. And the public defender would say, hey, would tell their client, you should do the DA's program. It's really good for you. And then the judge wouldn't want to allow them to because, well, we're already in court now. You know, you lost your chance. And so we had to retool. And what we did was, and this is, you know, it's an extra step for us, but on that date that the person's cited for, even if I'm planning on putting that citation into court, well, the guy didn't show up for his orientation, I can't get a hold of him, tough luck, I'm going to put that citation into court. We don't put it into court, but they think they have a court that day. So they show up, we meet them and say, hey, go talk to the public defender. The public defender says, hey, you should get into this program. And then we tell the public defender, all right, I'll give you 2 more weeks. Tell him to get to the orientation, you know, next week. If he gets there, I won't put this case into court. So that last step, we created an extra, one last entry point that we allowed them in. And once we did that, we were catching a lot more of those people. Because, I mean, there's not going to be a defense attorney who says, don't go into this program. Now, it's still up to the suspect whether they do it. But when they're there with an attorney who's advising them, it's in their best interest to do it. We're getting higher compliance. So it's a great question. You've got to be, you always have to be looking for it, and don't be so rigid in your policies that you can't, you know, make changes on the fly to help people who need it.
Well, and I think for the both of you, the issue about community engagement as well, like what does your community want and need, right? I think Melissa, you was using that phrase, you know, not you know, they demand or deserve, like, but what would really address this? How do you engage it? And how do you get to the point that it's not, once again, here, look what the prosecutor is doing to me. Like John, I liked your comment saying what defense lawyer would say, don't take this program, you know, go get yourself a record, get a weekend in jail instead. But how do we engage? What is necessary? So we're not just doing things behind the scenes.
Well, I'll tell you this, it's funny, we've come such a long way on this. I feel like if we were having this conversation 7 years ago or so, we'd be like whispering, like we don't want people to think we're soft on crime, right? But I tell you what, now that the rabbit's out of the hat, I talk to community groups, just like Straight Talk Express. I tell them about this program, like, absolutely. Why didn't you do this a long time ago? We're also afraid in the criminal justice system that the communities would rail against us. And the community's been dying for this, literally, actually, with the overdose deaths, but figuratively too. Our community's been dying for this type of leadership. Every time I speak at the, you know, the Cold Chicken Circuit, the Lions Club and the Kiwanis Clubs, all the time people come up to me after, my uncle struggled with this, my mom struggled with it, my daughter is doing this. And so How do you engage with the community on this? Directly, compassionately, in a straightforward manner. And the community is 100% behind us on this. And that's really neat to see. We were so afraid of it. And then they're like, where have you been, Hummel?
Melissa, some thoughts?
No, exactly. I mean, I thought coming out of law school, coming into the prosecutor's office, I thought, and I did face some resistance from people who just weren't completely on board. But again, that's getting out and talking to law enforcement, talking to the community. But the vast majority, when you're out in the communities, which I try to do as much as possible when I'm out in the community events, showing up and supporting and just being able to show them who I am, and with my prosecutor who does that way more than I do, we're able to see that the community wants this. They need that. I saw that from my loved ones, my family members, the people that I knew when I was using and I was getting high. So when I got out here as a prosecutor to tell them about these programs, same response. Why haven't you been doing this? This is what we need. We need to be helping individuals and really taking on that community policing and community building stance that we have as prosecutors and as law enforcement officers.
And Melissa, while I have you, generally in cross-examination, you never want to ask a question you don't know what the answer to is. First off, congratulations on your 11 years of sobriety.
Thanks.
And I noticed one of the things you said was abstinence. We now have a question that came in about MAT. What about the medically assisted treatment? For a long time, like John says, 7 years ago with drug courts, abstinence, right? That's the only way you could get in, and you had to be. I don't know how personal that question might be. I don't know your thoughts on is that another pathway to treatment? Is that an appropriate pathway to treatment?
Yes. The answer is yes, and nothing too personal. I'm an open book. At the end of the day, abstinence-based recovery, 12-step recovery was my journey. And so since 2011, I've really been able to stay on that pathway, and it works for me. But along this journey, I have met a lot of people who have taken other avenues, MAT, faith-based, even harm reduction. And again, going back to that definition about what recovery is from SAMHSA, these individuals get to choose what recovery means to them. That's why we incorporated recovery coaches into our program. People are in recovery when they say they are. And I think there's a shift not only within law enforcement, not only within the communities, but even in the smaller recovery community, that people are able to have this self-directed path into recovery, and they get to choose if that involves a medication or if that chooses going to 12-step programs. There's also been this blossoming of other fellowships and recovery communities from physical recovery communities that we've really seen take this important role in our communities, and being able to recognize their value, I think really enhances our programming. And so our Operation Helping Hand 24/7 operation really doesn't force anybody into abstinence at all. If you want to just communicate with the recovery coach, you're welcome to do that. If you want to try another pathway, we'll help you get that treatment for medically assisted treatment. We'll help you get into detox if you want to perhaps do MAT through treatment or some other type of abstinence-based program. But again, we let them be self-directed in what they're doing. And also what's really cool in New Jersey, we have been able to open up our drug court programs to incorporate medically assisted treatment. And what they've seen is that it works. So that was an easier sell for deflection and diversion, because the drug courts, have been doing it for a couple years now. And so as we blossomed these deflection and diversion programs across the state, we've been able to incorporate multiple pathways to recovery. The last thing I'll say is this is a big part of training I do for officers, talking to them about multiple pathways, what it is, why it's important, and then being able to really hash it out with them about why they think one is superior. And usually at the end of the training, they come around to realize that any pathway that an individual chooses is usually beneficial to them, and they should be able to choose any pathway that they wish.
All right, and before we go to John, because the other half of the question, John, was about beer. So, but Melissa, before we leave you, one of the questions is, what about formal policies and procedures? Would both of you be willing to share your policies, procedures to help folks set it up? And if so, I think probably the best, put it to Marlene, but either run it through us and we can extend it, or and maybe that's the best. Marlene's already got her email there. So for those interested, Marlene, maybe if you want to post again the email, we will get that, as well as I think we've got some other programs that folks might be interested in.
Yeah,
John, sure. Okay, sorry. Let's turn to John. Probably inappropriately, I can't think of your county without thinking about beer. We're talking a lot about substance abuse. What about the evil? Because I know alcohol is a drug. I used to prosecute the driving under the influence cases. What about the alcohol? Are we doing enough there?
Yeah, it's Deschutes County is known as one of the top beer producing counties in the country. It's a big beer culture here. We're a former timber town, so kind of like hard drinking, hard work, hard drinking, community. That's kind of the ethos here. So we definitely have a big issue with people who are addicted to alcohol. And legally, I won't get too in the details here, but legally, I'm restricted in what I can do on alcohol offenses, alcohol driving offenses. Oregon created a diversion program. It's a post-charge, post-conviction program for impaired driving. That's the exclusive program in Oregon. So we do see good results with that program. The issue I have with the program is like, the issue I have with drugs. It's just focusing on, treatment for, alcohol. It doesn't focus on other life, challenges people might have. But in other charges, this is where I'm excited about, what Melissa's program is doing. Don't limit it by charge. And so while impaired driving is the most challenging alcohol-related crime we have, alcohol is certainly a contributor to other crimes as well. So I'm thinking about how, the model is there. I mean, you can plug and play with any drug. It's not different if it's heroin or, meth or coke or alcohol. The treatments will be different, but since I'm not doing the treatment, I'm sending to a primary care doctor who will refer out. It's a great question. I think us in the criminal justice field, and maybe elected DAs too, we kind of, we look to the shiny object, the new thing, like opioids a few years ago was the new thing, and now fentanyl is the thing. And sometimes oftentimes, almost always, we neglect to focus on the fact that alcohol is the #1 drug problem in almost every community in this country. And so, and actually that question just made me reflect on that a little more. So I think it should be open to alcohol, and I'll be looking into that.
And if I may, just to
By all
touch
means.
in our police department programs, where people self-refer them, walk into the police departments, officers clear warrants if there are any, and then get people introduced to treatment if that's the path they want to take at that point. That's open to anybody who has an alcohol use disorder or any type of substance use disorder. We really want to be more inclusive than exclusive. We see a lot of these diversion and deflection programs, especially in light of overdoses, really focusing only on opioids. And I think if you're developing a program, if you're here to learn how to improve your program, really be more inclusive. There is specifically here in New Jersey an uptick of methamphetamine use. So thankfully we were able to incorporate all types of substance use and alcohol use into our programs. The other thing, and I don't think that I mentioned this before, but even the people in our 24/7 operations who are arrested, we don't keep anything hanging over their heads. It's unlike John's, where there's a citation issued and it is, you know, if you complete it, it might go away. We really make no promises up front. Besides that, we will help them get on a path to recovery if that's what they want to. In the same kind of breath, I will say that if they're working with a recovery coach and they consent to releasing that information to be considered by the prosecutor, be considered by the judge, by the public defender, any of that mitigating information is taken into account. And we, in circumstances, will appropriately plead that case based on their efforts in recovery, but nothing that we do, if the person says, no, I don't want this program, nothing is going to be held against them. Again, in the same thought process that we want to protect the integrity of the program and really portray that we're here to help if you want it. And if not, you know, you may have consequences, but they're not going to be increased based on your wanting to get into recovery or not.
Hey,
And
Dave, if I could
Jesse,
jump in
oops, go
real
ahead,
quick.
John.
Just before,
Sure.
I know we're getting near the end and I don't want to lose this opportunity. Melissa, I just want to say you inspire me. You've been so impressive these last few months. I've gotten to know you and your direct communication style. You've helped hundreds of people and you'll help hundreds more in your career. I just want to thank you and let you know you're a credit to our profession.
Thank you, John. Thank you so much. It was a pleasure getting to know you and to learn about your program, and same, being able to see what works in other people's communities only makes what I do even better.
And I was going to say, probably for the wrap up, Jesse, if we can open up Marlene's mic. I think one of the concerns that we got nationally is always, it's great to hear larger offices or offices that have resource, but what about the little ones? But Marlene, do you have some kind of final remarks?
Sure, thanks Dave, and thanks both to John and Melissa for offering their insights, your expertise, and you both just work so hard, and it just shows how much you care and how much your passion is really translating into changing lives. So thank you both for all the work that you do and for being willing to share. I think one thing that APA is trying to do is just uplift these stories, uplift these programs, and just try and share the wealth. So you're all working so hard. So how do we get that to other offices? How do we make sure that we're not having people work in silos and reinvent the wheel by being able to share all of this? So for, I guess, to wrap up, do you each have, I guess, your insights, one final lessons learned or something you wish you knew when starting out this work? And particularly, we hear a lot from offices who don't necessarily have a lot of resources or are very large. So for offices in that range, are there things that they can do or places they can start? And thank you both again.
Thanks, Marlene. My best advice is just go for it and just bring those stakeholders together. If you can't get your local DA on board, bring together those community organizations, those grassroots advocates, those people in recovery. They are extremely talented in their ability to come up to community solutions. So get them on board. My other piece of advice is, you've heard a lot about John and my program in Burlington County and them going 24/7. If you just want to do a one-day operation, like tomorrow here in Burlington County, we'll go out to the train station in one particular community and provide resources with volunteers and engage the community, give out toiletries, stuff like that. That is just as effective as running 24/7, and it's a starting point. So if this is all very overwhelming, please, there is a model out there for you to incorporate, but sky's the limit, and this is the beginning of deflection and diversion in the US. And so I'm happy to be here with you, John, Dave, Marlene, Leslie, everybody else who put this together, because it's what we make it, and it's dedicated individuals like you who are improving our communities and making them safer.
I'll say, I've said it before, get to know your federally qualified health center, schedule an appointment with them. They do great work, and I'm confident they'd want to help you. Also, I was remiss in this regard. Don't think that you're going to have to find a way to convince the police to do something they don't necessarily want to do. I think they're more with you, and this, I'm talking to prosecutors here. I think they're more with you than you might know. For cops on the phone, you're like, yeah, Hummel, of course we're with you. It's about helping people, saving lives, and reducing crime. And so lean into that. Get the police involved early, and the line officers, the patrol officers. So fairly qualified health center, reach out to patrol officers early. And then of course, PTAC and Melissa and myself and David, find allies across the country that you can call and ask questions about. You'll find that we're all in this community always willing to help people who are just starting out on this journey. And thanks to everyone for coming, and thanks for inviting me to speak. I enjoyed it.
Excellent. Well, kind of as the wrap up, I would encourage folks to also go to our website, apainc.org. We have what on there is the Prosecutor-Led Diversion Toolkit. That also will give kind of walking folks through ideas of where you can go, as well as that prosecutor leadership. I don't think I could do any better than what John said to you, Melissa. It's just amazing to go through the pathway that you've been through, and your ability to change lives. John, you need to be congratulated as well, though. It requires leadership. It requires change. It requires taking all the assets that you're aware of. And I think you have been really a leader in that, to tell folks, hey, check out what was available under the Affordable Care Act. Go to your navigators. It's not often that prosecutors you pick up the phone and call them. And I think that's one of the struggles. There are resources and programs available because it's all trying to help. So at this point, I believe, unless Jesse has any final close for us, we're going to say thank you to all. Thank you for the attendees. And please follow up, ask both here at the association, make us work, make PTAC work, and go through those resources, as well as following up directly with Melissa and John. Thank you.
Thanks, everyone.
Thank you.